Hey, Kristen.
How you doing?
Doing good.
Perfect.
Welcome back to another episode of Behind the Dirty Needle,
Yes,
where
today's gonna be interesting.
this is a juicy episode.
Literally.
I can't believe I just saw that. The craziest things that we've seen in the aesthetics industry. And between the two of us, we've seen a thing or two.
Some of the crazy things. There's gonna be
But
more that we can talk about.
th-
There's not enough time.
no, these are just like
Yeah,
this is like a highlight reel, I would
this is
say.
just the beginning.
Yeah, this is
We're just
scratching the
getting
surface of the iceberg.
started. Yes,
hmm
exactly.
So, you know, radius and temples,
What?
sculptura in the glabella.
Why?
Beats me. YouTube tutorials just minutes before someone gets injected.
Duh.
If you think this industry is all white coats and glowing skin, think
Think
again.
again?
Think
Really?
again.
Shit.
Because behind the perfect filters and five-star reviews
Hmm?
lies a mess that no one wants to talk
You
about.
don't say.
We want to talk about it.
Let's talk about
Let's
it.
talk about it.
Yeah.
Today, we're taking you behind the scenes and behind the dirty needle. See what I did there?
I did.
To expose the most shocking things we've personally seen in the industry.
Yeah.
Some of it's dangerous,
Eesh.
some of it's unethical, and some of it might just make your jaw hit the floor.
Not the jaw hitting the floor.
Let's get into it.
Let's do it. Okay, let's talk about YouTube University.
Oh,
Have you like applied?
I have actually several diplomas from YouTube
Do
University
you?
and from the Google as well.
From the Google.
From the Google.
I know that YouTube is a thing,
It is.
and it can be a very resourceful thing,
Mm-hmm.
but also very frightening when you're utilizing that as your training.
Oh, yeah. I've actually seen injectors have paying patients come in for like Skin V, for example, which is
Oh my
it's a
gosh.
newer product, so there's a newer injecting technique, and so they have a patient on the books, and what are they going to do? Turn them away? No, we don't do that in med spa. We
No,
want to make that money.
exactly.
So I've literally seen somebody get on and watch a YouTube video, um, and and then go and treat the patient.
I concur. I have
Yeah,
seen the same way too often,
yeah.
more often than I'd like to admit.
And I mean, while that could be a good, you know, supplement or brush up on, like if you had a training a while back,
For validation, maybe?
yeah, this was not that. This was like their entire education for how to inject.
It was the schooling.
It was
It
the
was.
training. So,
Okay. And this is not to discredit from the people out there who have done it right. It's just we're talking about the people who are disrespecting
mhm.
the people who have done it right
Well, and
with cutting the corners.
I think we're raising awareness too
Mhm.
because there's a lack of training, you
And
know.
a lack of regulation of that training.
hmm Like if that injector wanted to get a training on Skin V, how would she go about doing that?
Right.
Getting a hands-on training,
Right. Yeah. Especially when the pressure's on to make the money with the skin bead they just purchased.
like right now.
Right. Yeah, like 2 minutes ago.
Yeah, actually yesterday.
Yeah.
Yeah.
Even the day before
Let's talk about unnatural results, like
that.
crazy filler patients we've seen.
And beauty is in the eye of the beholder,
It
right?
sure is,
Yeah.
man.
But what is pretty to me may not be your cup of tea, Catherine.
You know, I have one clinic who's really, really, really good about doing before and afters consistently. And
Amen.
yeah, I love it. They do
That's
that
great.
so well. But while we were pulling pictures for an Instagram, with the posts that we were putting together, we were looking through before and afters of this one patient. And this
Hmm.
patient had been seeing an injector at this clinic for 7 or 8 years. And as we were clicking through the pictures, I happened to glance down at my phone for a minute. I had a text message or something. And then when I looked back up, I thought we were in another patient's chart. That's
Okay.
how different this
In
patient
a
looked
good way or a bad
in
way?
a very bad way.
Oh, no.
Yeah. And like you said, to some people
Hmm.
that's what they want. The injector that she was seeing at this clinic for 8 years
Shout
has,
out to the 8 years.
yeah, that's a great, beautiful
I mean, that's
relationship.
insane. Yeah.
But this injector, in my opinion, is overfilled as well. So,
Oh, so it's a pattern.
you do kind of gravitate towards what you're attracted to.
That's the art that they like.
But I mean, it's incredible to me. Like, it's at no point did anyone tell her like you're not looking like yourself anymore.
So you yourself would not be injected by this particular injector.
No, no,
Okay.
no,
Hmm.
no. But I think
Interesting.
we've all seen cases of people with overfilled. I think lips are the most common area that we see it. where
Yeah.
they've gotten overfilled and overfilled and overfilled, and they've never had it dissolved. But
Mhm.
just it's a walking disaster.
Yes.
So,
Yeah, yeah. Yeah.
yeah.
It's frightening,
Mhm.
and, there's some people, if you watch all those TV shows where things have gone not necessarily right,
Botched?
I love that show.
Me too.
Um, it it's like people want to be huge and big, and bigger is better type thing, and then there's providers who will do it because they want the money.
Yeah.
But what they don't realize is that's walking advertisement. Like, I would not want my work going on a show like Botched,
Oh gosh, no.
being corrected. I mean, that
Yeah.
would be the ultimate insult to my
You as an
career.
injector. Yeah. Yep.
Yeah.
Let's talk about as far as shocking,
Mm.
people credentialing themselves saying, "Oh, I'm a master injector and
Yeah.
I've gone through all this extensive training," when the extensive, quote unquote, extensive training was a 1 day course where they were sitting in the audience watching other people inject.
Right.
Yeah, that happens. That happens a lot, actually.
So what is the true definition of a master injector then?
There's not a definition. I mean, I think a master injector is one that listens to the patient and is ethical and clean, sterile. But these 1 day seminars are giving injectors like the certificate saying, "Congratulations, you've completed this aesthetics course to become
Hmm.
whatever."
Yeah.
And they frame it and then they put that on their business card. And so as a consumer, I'm thinking, "Oh, that's a good thing. That's a reputable
Or
company."
the website?
Yeah.
Hmm.
But the reality of it is anyone can attend those clinics, right?
Right.
Sometimes I will
Do you
tell
have
you
to be invited though?
you do, but I
Okay.
will tell you there have been times where I've just tried to get butts in chairs before. Like I literally, I was just trying to fill up my spots for that clinic. So I
Hmm.
wasn't as particular as I could have been. I mean, obviously, you try to be strategic. You try to invest in your good injectors as a
Mhm.
sales rep, but that doesn't always happen. I mean, people have family commitments. Sometimes these um, seminars or these trainings can come up on us last minute,
Yeah,
and we're
I
just
remember. Mm.
we're just trying to get people there
Right.
because we have brought somebody in, and paid them money to you know, get up there on the stage and talk about different things that can arise.
Mhm.
And don't get me wrong, these are very valuable trainings. They're great, but that shouldn't be the extent of your training as an injector.
Absolutely not.
Like that should
It
just be
doesn't
a
stop
supplement.
there.
It should be just a supplement to it.
In addition to.
Yeah.
Mhm. Agreed.
So
Wow.
that's happening a lot.
Hmm.
Um, let's talk about the dirty things we've seen,
Oh gosh.
like dirty gloves, dirty habits.
Or lack of using them?
Oh wow.
Yeah. So I have, and I'm being for real, doctors, nurses, estheticians, PAs, NPs, not using gloves for some procedures.
Why?
Well, I can only vouch for one when I actually asked, like, "Why were you not wearing gloves?" In a way, because we were filming a video for Instagram.
Without gloves?
Well, so he thought.
Oh,
So
oh,
I told this
oh.
person that I could not post this
Without
because
gloves.
the gloves, would be questioned.
Yeah.
And the response I got was, "But I can't maintain control like I can without the gloves."
What if
And
that person was doing a surgery?
mm, this person may or may not have been a general surgeon. But anyway,
What?
I just
Oh, wow.
I just want people to know that I didn't feel comfortable
Mhm.
as a manager to argue to a doctor.
Yeah. So I've never seen the lack of gloves being used, but I was in a training one time and I the patient was numbing and we were setting up the room and we needed to move the trash can just to have some like walking room around the patient.
Mm,
It's kind of a small area. Injector rooms are always small areas. And the
typically.
injector had her gloves on. She was gloved up. She'd put the numbing stuff on the patient. She grabbed the inside of the trash can, like grabbed the lip of it with her thumb of her gloved hand and moved it to the
Hmm.
side. And then went back and started touching the patient's face again, like getting ready to inject.
Were you the only one that noticed that as odd?
No, I believe the trainer and I exchanged glances, and I said, "Hey, do you want a new pair of gloves?" Because
So you did speak up.
oh yeah,
Good.
absolutely. Because we're in a training, and if something goes wrong, that comes
Yeah.
back on me.
Yeah.
And I kind of wanted to call her out without like making her look bad to the patient
It's
because
hard.
you
Yeah.
don't want to make the patient, feel
Especially in a training.
they're
Hello.
already it's already iffy, right? No.
Yeah.
But it wasn't a rogue injector. This was somebody at a plastic surgeon's office, and this was during a training, and it's kind of crazy to me that that even happened.
That's nuts.
So, yeah.
What was her reaction to you saying something or being called out?
I did pull her aside afterwards and I said, "Hey, I don't know if you realize this, but you touched the inside of that trash can with your gloved hand. I just want to make sure, I wanted to make sure that we were protecting you and keeping you safe because, aseptic technique is super important, especially with these fillers that are super efficiently cross-linked. You get any little bit of bacteria in there, it's got to get in there and fester."
Mhm.
So I kind of talked to her about that, and I recommended to her that she videotape herself when she's injecting to see how many times she touches her face or touches the patient's hair, or she just had a propensity to touch things and not realize it.
Hmm.
So I think you have to be honest with people. I mean, it's safety that we're talking about. It's the patient's safety, it's their outcomes. And she was actually grateful for it. She like was open. She was the kind of person I could talk to about it, but it's definitely not a fun conversation to have.
No, and let's just take a minute for you even feeling like you had to tiptoe on bringing that up in a gentle kind of
Well,
way
I'm just kind of
without being disrespectful
yeah.
when really you're coming from a place of safety.
Yeah, but there's that patient and provider relationship I want to be respectful of.
Yeah,
But yeah, I mean, yeah, you do kinda
it's a
tiptoe around
fine
that.
line
It
of
is.
just, you advocating for what's right. And are you stepping over a line
Mhm.
or are you protecting that line?
Yeah.
It's
There's
an
a lot of
interesting
there's a
argument.
lot of gray areas.
Yeah, lots of gray areas for sure.
Yeah.
Yeah.
Um, Something
Wow.
else I've seen happen, and I know you have too, you
Mm.
can probably speak to this more than I can, but when something goes wrong in a treatment or in a filler, whatever, blaming the patient.
Gaslighting?
Yeah.
Yeah.
Have you run across that too?
Oh, 1000%.
Okay, yeah.
And, you know, the last thing we want to do is give a refund because
True.
I can't take back that filler,
Well,
that
and
Botox, right?
even, like, say you needed to dissolve a nodule or something,
Hmm.
you know, why not make that the patient's fault rather than your injector's fault so they have to pay for the hyaluronidase? Because we know
Right.
how expensive that is, right?
Yes. Yeah. There's a cost to everything.
There's a cost to everything.
And the cost of time too. Sitting
Mhm.
there talking to the patient is costing me
And
time,
yeah.
right? So, but it's always easier to deflect and
Yes.
say, "Oh, you massaged it too or soon. You're not giving it enough time. Come back in a couple of days. Call me, send me a picture, blah 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 blah."
Mhm.
Instead of just fixing it
Mhm.
and calling a spade a spade.
Yeah.
Now, I'm not here to say what can be fixed and what can't be fixed in
Yeah.
that moment because
Now
that's
sometimes
a
things
clinical
do
decision.
sometimes things do resolve over a couple of days, like
Sure.
that can happen. I know certain fillers like ones that replicate bone, they will
Mhm.
have kind of some lumps and bumps for the
Yep.
first few days.
Mhm.
But what we're talking about here is like where there's clearly something that's wrong that needs to be addressed, that
Right.
needs to be dissolved or whatever.
Mhm.
And we're trying to blame the patient on that
Right.
or blame it on the patient.
Right. And
Even if it was the patient's fault, I mean, that kind of comes back to you on an injector. Like, did you give them proper care instructions?
mhm.
Like, did you actually tell them what could happen if they didn't care for that
Right.
properly?
Right.
So ultimately, the buck stops with you.
Yeah, for sure. And if you think by gaslighting it's going to be a good thing, you're asking for a negative review
Absolutely.
because even if you make it right, you still put the blame on them and they
Mhm.
may or may not talk about that if they feel like they want to.
Yep.
And they have every right to.
Yep.
Yeah.
Um, let's talk about well, we've already talked about the medical directors, the lack of medical supervision. That was shocking to me when I first came into the industry.
Mhm.
You should go back and listen to one of our previous
It
episodes
was a good
about
one.
that. It was really good. But basically, you and I have both seen it.
Mhm.
Medical directors pimping out their medical license, and
Cuz they can.
yeah, they can make a couple extra $1,000 a month. And if
Yeah.
they knew what was actually happening in there, I think they would lose some sleep at night.
Well, putting your license on the line like that.
Dude, I don't. If I got a medical license, I
Yeah.
would I would
All
protect that
those
thing.
years
Yeah.
of oh,
Mm-mm,
I
mm-mm.
can't even
Nope.
imagine.
Nope.
Yeah.
Um, Injectors restricted by owners who override their medical judgment. Have you seen that?
You know, I know that's a thing, but I have always been in the stance in my position of protecting the provider and the provider's decision.
That's awesome.
There's always a reason why things were done the way they were done, and I
Mhm.
trust that professional and that provider in that decision, and I will support them even if I don't understand. I will be
Yeah.
like, "Okay, yeah, I'm here to be an advocate for them."
Yeah.
And then an advocate for the patient as well. But I've never been in a position where I've had to tell somebody or dictate to a provider how to do and what to use or anything like that. I just would never cross that line.
See, that's awesome because I've actually seen the other side of that. I've seen where injectors were basically told they had to use this product
Oh,
first or this product over another one because of the expiration date or because of, they made more money on this SKU than they did on that SKU. And
wow.
so literally they would have, kind of knockdown, drag out fights with the owners. If the injector was outspoken enough, some of them just kind of put their head down and do what they're told. But I mean, yeah, like you said, this is a provider, this is their art, and they
Mm.
were really being told what they could and couldn't do.
I just think you're asking for that person to leave.
Yeah,
You're
100%.
doing more harm than good by doing that.
Yep.
So,
Um, the before and after fakery in the social media trap, that's
hmm,
also shocking.
yeah. My favorite is when people use other people's work as their before and afters to show,
Do you have like a specific
like
example?
liposuction.
Oh, yeah, that does happen a lot with liposuction.
With and without transfer.
Yes.
So, as we all know, if you're gonna get a BBL, the Brazilian butt lift,
Hmm.
using your own fat, can't use somebody else's. That's just
Nope.
not how the science is right now.
Nope.
I wish it was because I would donate in 2 seconds. Um, but you have to have a good amount in order to get this result that
Right.
they are showing as a possibility of what this machine is capable of doing.
Yeah.
And I remember having pictures of somebody else's work from, like, Ohio or something like
Yeah.
that, of this is what this machine did
Yeah.
with and without transfer, and, you know
It's very misleading
yeah,
because I
yeah.
feel I feel like that happens especially with liposuction. I know I can think of 3 or 4 other accounts that I've worked with before that have used another plastic surgeon's who is a
Mhm.
trainer for this particular device or that
Yep.
device. They've used their photos for their before and after of what is possible. Well, yeah, that is possible, but this is somebody that actually trains for that company, that's actually traveling across the nation, like, speaking for them.
Mm.
The results from the actual doctor at that clinic, you better, like, cross your fingers and, your toes and your eyes and all the things.
All the things.
Because the reality is if they're not doing it very often and it's, you're taking a chance there.
Yes.
Yeah,
Yep.
that's a really good example. I
I
like that.
I know in-office liposuction,
That's the next, yeah, we're just right into it.
there you go, um, is something to talk about because I've
Yes.
worked in multiple places now that offered it because we had a doctor's office attached to
Mhm.
us. We were in no way a surgery center or
Nope.
anything like that. But there were some cases that went really well because there's, localized anesthetic instead of the, you know, anesthesia that puts you under.
Right.
So there's this downtime, faster healing, blah, 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 blah. But to me, there's candidates for that type of
Mhm.
procedure and people who need, the big whammies of plastic surgery.
I will say too, from a consulting standpoint, I've gone in and watched some of those procedures, been part of that,
Hmm.
and seen, what it's like in an OR setting versus a medical spa setting.
Hmm.
And in the OR setting, it's very efficient. People know their roles, they know how to do things.
There's a sense of urgency too.
Yeah,
Yeah.
absolutely. They're doing this all day long. They got to get through these cases. In a med spa, there were 7 people, 7
Everybody's
full-time
confused.
employees
Of
trying to set up liposuction for 1 patient. It took 2 hours to set up for the liposuction.
course it did.
And, it's because 'cause they're not doing it very often.
Right.
And, it just goes to show, I think if you're going to get something done, go to somebody that's kind of specializes in that.
That's my suggestion too. I mean,
Yeah.
people are going to do what's going to be the most cost effective at times. And,
True.
there's people out there who do a phenomenal job,
Yes.
but we're here to arm you with
The
what to ask and
knowledge.
the knowledge.
Yeah.
Yeah. And just
Can I
beware.
see your before and after photos of patients you've
Exactly.
actually treated with this
Exactly.
machine?
Right. Because before and after photos, you guys with liposuction do not happen overnight.
Nope.
It's the before can happen in 2 seconds because obviously that person's there to get treated, but that after isn't until sometimes 9 months to a year,
Yes.
depending on their age, of when that after is really the after, if that makes sense.
Totally. Yeah.
And I've yet to see somebody actually follow up like that.
Yeah. It's hard.
Mhm.
We've already
And
talked about
post it.
we've
Right,
already talked about the before and afters and the
right.
challenge that they present,
And
but
there are some clients who do not consent to having their pictures
yeah.
posted.
Yeah.
So,
I mean, if I got liposuction, I probably wouldn't want that posted all over, social
yeah,
media, even
I
if my
mean,
face wasn't attached to it. Somebody might recognize my body.
oh.
No, I mean, like,
You said it.
uh,
Okay.
well, somebody, I don't know. I
Right.
I can understand why people wouldn't want to have it out
Yeah.
there.
Yeah.
Moving right along.
Moving along. Anyways.
This industry, the facade is beautiful, but what happens under the surface, it can be
Yeah.
quite shocking,
Shocking.
which is why we're here.
Mhm.
And that's why we're glad you're here. And
Very glad people are here with us. Yes.
want to continue the conversation. Um, Follow us on Instagram. If,
Mhm.
if you learned something today, please share this episode with a friend who's thinking about,
Yes, tell your friends,
yes, tell all your friends.
all of them, even if
And
it's just one.
yeah, that's a good idea.
Yeah.
Tell your friends.
Yeah.
And yeah, share with us your stories. We want to hear from you.
Let's talk about it.
Yep, tell us your shocking stories
Whether
because
you agree with us or not,
yeah,
let's talk about it.
let's have it out.
Do it.
So, thanks again for joining today.
Thanks everybody.
Bye.